Hi, I'm Lexi.
And I'm Grace, and today we're going to be talking about the spaced retrieval training method. Spaced retrieval is an evidence-based memory technique that uses procedural memory to help people recall information over progressively longer periods of time. So anyone can use this technique, but from research, it's been found to be especially effective for helping people with Alzheimer's disease, Parkinson's disease, traumatic brain injury, and aphasia. And spaced retrieval can be done anywhere by anyone familiar with the procedure, but it's not meant to be done by the person with the memory impairment alone. In patients with dementia, procedural memory is often the least impaired, and it doesn't worsen until much later in the disease process. So for this reason, spaced retrieval uses procedural memory to access and improve the weaker type, so episodic and semantic. The study that I research was called A New Frontier in Spaced Retrieval Memory Training for Persons with Alzheimer's Disease. And the treatment type was semantic, prospective, and episodic. And the study design was a quasi-experimental multiple baseline design. So this study was designed for individuals with Alzheimer's disease or amnestic mild cognitive impairment in order to improve their recall of selected semantic, prospective, and episodic memory targets. And for the participants, 6 had Alzheimer's and 2 had mild cognitive impairment, and all but one of the participants was male. Okay, so for the treatment protocol, the first thing that was done was an introductory screening session. And during this, the trainer and the participant and their families did work together to determine semantic, prospective, and episodic memory targets that they were going to work on during the training. And the participants with Alzheimer's were administered the modified mental state and the mini mental state examination, while participants with amnestic mild cognitive impairment were administered the Montreal Cognitive Assessment. And all participants were given the Boston Naming Test to determine the full extent of their anomia and a spaced retrieval screening test. So for the sessions themselves, they were 2-hour sessions 2 times a week over a 6-week period for a total possible number of 12 training sessions. And for each training session, there was 2 training sessions per target condition, and the trainings were spaced along several intervals during sessions. So 0, 1, 2, 4, 8, 16, and 32. And the training procedure itself happened where the trainer stated the target to be trained, the prompt question, and the target response to the trainee to the given prompt. And then immediately after, the trainee was asked the prompted question and expected to provide the target response. And if the trainee was unsuccessful in their response, the trainer could repeat the targeted prompt. And for maintenance sessions, during those, the control items along with the trained targets were assessed at the beginning and at the end of each session. Okay, so data was collected on the subject's accuracy in response to target prompts and during maintenance sessions with the trainer. The differences between the pre-established untrained target baseline control measures and their maintenance performance was averaged to determine their overall effectiveness with SRT on each condition. So for the episodic condition, there was also an additional measure to calculate the mean difference in the patient's percentage of recall of core details at their baseline control before and at the post-treatment maintenance. The results of the study found that following spaced retrieval training, all participants exhibited better target recall after training and compared to their baseline control across conditions at the beginning. So, and also in the episodic condition, after training, participants could recall specific core details about recent events. And although target prompt responses in the episodic condition were consistently produced, the core details of the events were accessed less reliably. So the author of the study said that in later studies, we might need to focus on maybe teaching patients how to recall those things without so many cues from like a trainer or clinician.
The article that I had was Spaced Retrieval and Episodic Memory Training in Alzheimer's Disease. And the treatment type was spaced retrieval and episodic memory training. And my study design was quasi-experimental within subject group design. And this research study was designed for individuals with Alzheimer's disease in order to help them enhance long-term recall of their episodic events. In the introductory screening session, the trainers administered the revised memory and behavior problems checklist, the quality of life Alzheimer's disease, and they also conducted a space retrieval screening test to see if space retrieval training was fitting for each patient. And then the training sessions consisted of 2 90-minute sessions per week over the 2-week study period. Training was spaced upon 0, 1, 2, 4, 8, and 16-minute intervals. And the training procedures, so the trainer stated the target to be trained. So for example, your wife's birthday party, and then the prompt question, what can you do to help you remember your wife's birthday party? And then followed by the target response of the trainee to the given prompt, which was, for example, I can watch the movie or video as the trainee pointed to the iPad. So if the trainee gave a successful response, then the trainer provided encouragement and spontaneous recall questions, followed by a review of the video. And then the trainer would wait 1 minute before initiating the prompt again. And then if the trainee gave an unsuccessful response, then the trainer would provide the correct response and then would go back to the previous successful interval. So for example, if the participant was unsuccessful at the 1 minute interval, then they would go back to the 0 minute interval. There were maintenance or follow-up assessments, and the 2 maintenance assessments were at 1 and 3 months to monitor long-term maintenance amongst all of the participants. So the data was collected on the subject's accuracy in response to the targets during pre, concurrent, and post-treatment monitoring based on the recall of episodic events with prompted questions and responses, and the recall of core details with spontaneous and cued questions and responses for both trained and untrained control events for over a fixed duration of time. And then the results showed that the trained group were able to spontaneously recall events, especially with cues. But in the maintenance period, they found that spontaneous recall abilities decreased. And then for the control group, they exhibited lower spontaneous recall overall. And then for the revised treatment protocol by Small and Cochran, for the purpose of this video, we chose to revise my article in the Small and Cochran 2020 study. An iPad was used, but since there is an older population who may not be as technologically savvy, we thought that this stimuli might not be as appropriate. So instead, using calendars, notebooks, or picture books to prompt memory recall may be a more preferable approach. So the client's information states that Grace Toops is a 69-year-old patient with mild Alzheimer's disease. She is seen for therapy once a week for a 90-minute session. The client exhibits the most difficulty with their episodic recent memory. The goal that we made for this client was that the client will utilize the picture book to accurately recall 3 out of 3 core details of an episodic memory target, given minimal to moderate verbal prompting from the clinician across 3 consecutive therapy sessions. And then the therapy stimuli that we chose was a picture book or scrapbook and verbal prompts from the clinician. The trainer collaborated with the client and caregiver to determine 3 episodic memory targets that they would like to target during training. We chose her wedding day, the day her son John was born, and the day she retired from her job. But for the purpose of this video, we're going to choose to focus on her wedding day. The core details of her wedding day that we're going to be targeting are her wedding year, which was 1971, that she got married in St. Mary's Church, and then that her husband shoved cake in her face. Here's our video clip that shows our SRT demonstration. What can you do to help remember your wedding day?
I can look at my picture book.
Yes, that's correct. Can you tell me anything that you remember about your wedding day?
It was at St. Mary's in 1971.
Okay, good. So since Grace is missing one of the core details, I'm gonna give her another prompt to try to elicit the core detail. Last time when we looked through the picture book, we were laughing at a picture. Do you remember what it was about?
Oh, my husband shoved cake in my face.
Yes, that's correct. Since Grace got it right after prompting, we can now move to the 2-minute interval. We created this data collection form to show the intervals that we were testing the client at. So for example, this was at the 0-minute interval, and Grace got the correct prompt response. She got all of her core details, so she did not need any extra spontaneous recall cues. And so her data states that in today's therapy session, the client accurately recalled 3 out of 3 core details of an episodic memory target, given no verbal prompting from the clinician. And then when we move to the 1 interval right here, it states that she got a correct prompt response. And then the amount of core details accurately produced were 2 out of 3. So we stated that she did not produce "my husband shoved cake in my face." So the spontaneous recall cues that we used for the incorrect response or no response was last time when we looked through the picture book, what picture were you laughing about? After that, she was able to correctly respond. So we recorded that right here. And then her data says that in today's therapy session, the client accurately recalled 3 out of 3 core details of an episodic memory target given moderate verbal prompting from the clinician.